Hello, and welcome to our presentation about music therapy. So, a bit of background. What is music therapy? Well, music therapy is the use of music for a variety of healing processes, such as the enhancement of memory or alleviating pain from patients. Despite what may be thought, music therapy is a functional form of medical practice that requires specific licenses in order to perform. Music is integral to most cultures as a form of entertainment and expression. However, many early civilizations figured out the use of music as a healing tool. For example, the ancient Greek god Apollo was both the god of music and medicine, showing the understanding of relationship between the two. There are also many ancient Chinese papers connecting both music and medicine, with people trusting music to even cure diseases. Plato and Socrates advocated for the use of music in medicine. Sorry. Many famous philosophers such as Plato and Socrates advocated for the use of music in medicine. The earliest Western study of music was found in a book named by the name of Music Physically Considered by an unknown author, which was published in 1789. Soon after that, two medical dissertations were published. In 1804, Edwin Atlee published an inaugural essay on the influence of music in the cure of diseases. And in 1806, Samuel Matthews published On the Effects of Music in Curing and Palliating Diseases. This was the beginning of music wide, being accepted by the widespread medical community as a legitimate form of medicine. Then, in the 1940s, important advances towards the widespread education of music were created. Due to the promotion of music therapy by Dr. Ira Altschuler in Michigan, Michigan State University was the first college to establish an actual academic music therapy program, with many other colleges following suit. Also, in 1936, Music and Institutions by Will Van de Waal was published as a sort of guide to music therapy and how to implement it in practice. So, how has this progressed? Well, these advancements led to the creation of multiple organizations dedicated to spreading awareness and advancement of music therapy as a practice. This has led to today, where we have the American Music Therapy Association, which still works to help people learn and understand the benefit and importance of music therapy.
Hello. So, in regards to music therapy, I will be diving into what that looks like career wise. What credentials are needed? Where do they work? So, let's get into it. So, how do you become a music therapist? Well, there's many different paths that you can take, but you can begin by earning a bachelor's degree in music therapy from from an American Music Therapy Association approved institution, or the AMTA. This degree looks like 4 more years of schooling with 1,200 hours of clinical training. These hours are embedded into the courses along with a required internship at the end of the degree. Students must also pass an exam to earn their credential as Music Therapist Board Certified, or MT-BC. This is administered by the Certification Board for Music Therapists. However, individuals with a bachelor's degree already in a related subject, such as music, education, psychology, etc., can apply for an equivalency program offered by the AMTA. An equivalency program means that the student completes the required coursework needed for the program without getting a second baccalaureate degree. They must also pass the national exam to become certified. For individuals seeking further education, such as a master's or a doctorate, they can earn one after getting their bachelor's or master's in musical therapy, or they can apply for a master's equivalency program. There's also online options for those that have already completed a bachelor's degree in music if they want to earn their master's online. So here's a really great image that I found from the official website for the AMTA, and it really kind of displays all the different pathways that are out there for becoming a music therapist. So now we look at where do they work? So music therapists are often in hospitals, schools, and within the community. At hospitals, they work in hospice care, oncology centers, psychiatric hospitals, and overall aim to help patients that are perhaps stressed about a surgery or treatment, have mental illnesses, and need help as they go through their medical trials. They also work in schools, mainly in special education programs, where they attend to students with disabilities or aid music and special educators. They also work in the community with senior care facilities, nursing homes, drug and alcohol abuse centers, or just a private practice where they run their own sessions and patients. So, thank you.
Okay, now since we know about the history of music therapy, let me talk about the different kinds and who benefits each one of them. According to Surrey University, there are 4 kinds of therapy, which are composition, improvising, receptive, and recreative. Composition therapy allows the patient to add chords or notes to an already known tune. For example, I have 2 of the same pieces called Here We Go Round the Mulberry Bush in E flat major, except the top one is one given to the patient and it started a corporation of 1155 for the first 4 measures, and the bottom one is made by the patient, making their corporation of 127 127 275 for the first 4 measures. Now let's hear the difference between both of them. What's beneficial for this kind of therapy is for those who's going through grief or have low self-esteem and need that confidence boost by accomplishing something. Second type of therapy is improvisation, which is similar to composition, but this time the patient is playing with the therapist. For example, the next clip I will show has the patient playing drums and he is creating its own rhythm to the duet. This is beneficial for therapists to identify the problem the patient has by analyzing their mood, which most of the time involves trauma or similar symptoms as composition, which is grief or low self-esteem. Next is receptive therapy, which is when the therapist plays to the patient and analyzes their reaction to their playing. This benefits those with anxiety, people with memory loss, or have hard time hearing. Lastly, recreative therapy is when the patient is playing back to what the therapist played before. This benefits those with development issues or those with dementia or even movement disorder. To conclude, we have talked about the history of music therapy, the different kinds and benefits each one gives, and the requirements to become a music therapist and where they are located. We hope you enjoyed and learned more about music therapy, and don't be afraid to get an appointment to one of these therapy sessions because they might help you in the future. Thank you for listening.